Right. Good evening, and thank you for joining us. The North Carolina Association of Pharmacists is pleased to host this informational webinar providing a deeper dive into North Carolina Medicaid's pharmacy benefit administrator transition. I'm Penny Shelton. I serve as the Executive Director for the North Carolina Association of Pharmacists, and it's my pleasure to welcome you this lovely spring evening, and we appreciate your interest and your attendance for this evening's topic. Tonight, we have with us a team of professionals from both North Carolina Medicaid and Prime Therapeutics. The North Carolina Medicaid team of individuals that will be presenting tonight include John Mata, Director of Pharmacy and Ancillary Services, Amy Williams-Phelps, Clinical Pharmacist, Prior Authorizations, Raina Badlawala, the PBA Product Integration Specialist, Kafi Abualon, PBA Business Integration Pharmacist, Susan Wenga, PBA Business Integration Pharmacist, Jean Matthews, PBA Business Integration Pharmacist, and Krista Kness, a clinical pharmacist with Medicaid. From the Prime Therapeutics team, presenting tonight will be Julie Brown, Director of Education and Outreach, Kelly Schweitzer, Clinical Account Principal, Kim Phelps, Solution Product Owner, Frank Cardacia, Benefit Plan Configuration Advisor, and LaRon Thibault, the Solution Product Owner. Our speakers will be covering an array of content, demos, and frequently asked questions regarding the transition and what pharmacists need to know. At this time, I will now turn over the program to John Mata.
Thank you, Penny, and North Carolina Association of Pharmacists for hosting this event tonight. Good evening, everyone. Thank you all for joining us for our second NC Medicaid Provider Community Webinar on the new PBA launch for Medicaid Direct. This evening's presentation is designed to provide a deeper dive into the new Prime PBA going live for Medicaid Direct in just a few weeks. Over the past several years, our teams across NC Medicaid, our MES partners, and Prime Therapeutics have been working diligently together to prepare for this transition to our new pharmacy benefit administrator, which will go live on May 2nd, 2026. This work represents not only a technical change, but a meaningful step forward on how we support providers and meet the need of beneficiaries who rely on us every day. We are happy to share this information with you all today, not only because of what is changing, but because of what is not changing as well. Today's conversation is designed to give you all further clarity and confidence in the new Medicaid Direct PBA system. Thank you again for being here, for all the work you do every day across the state, and for your commitment to serving the nearly 3.1 million North Carolinians who depend on Medicaid for their care. We're looking forward to a productive and engaging session. So let's get started. We can go to the next slide, please. Here's our agenda for this evening. We'll start out by introducing the NC Medicaid Pharmacy team and the PBA implementation team, the people who have been doing the day-to-day work behind the transition. Next, we'll walk through what a pharmacy benefit administrator is and how this model differs from a traditional PBM, and why North Carolina is moving to this approach for Medicaid Direct. This will help provide clarity, roles, responsibility, and improvements providers can expect with this transition. We will then dive into the rationale behind the transition, including challenges with the current system, such as scattered pharmacy functions, limited rebate and DUR capabilities, and operational inefficiencies, and how the new PBA model addresses these issues. After that, we'll cover our pharmacy committees, including Drug Utilization Review Board and the Preferred Drug List Review Panel, which remains a core component of the pharmacy program. You'll have an opportunity to meet Prime Therapeutics team, learn about the systems and the tools that they are implementing, and see a live demo of the provider portal. Finally, we'll wrap up with questions from webinar number 1. The chat will be open throughout the webinar, so we encourage everyone to submit their questions anytime. You can go to the next slide. Here's our pharmacy team. I want to share that I'm so proud of the pharmacy team, the team that does extraordinary work every single day to support our pharmacies, prescribers, and the beneficiaries who rely on NC Medicaid. During webinar 1, we focused on highlighting some of the initiatives the pharmacy team has been working on So we won't elaborate on that again today, but I will say that the pharmacy team is the backbone of the NC Medicaid pharmacy program. Their work directly impacts patients' outcomes, access, safety, and the sustainability of the program. I'm truly honored to work alongside them every day. You can go to the next slide, please. Next, I want to highlight the PBA implementation team, the group that has been working tirelessly behind the scenes to bring this PBA transition to life. The state awarded the Pharmacy Benefit Administrator contract to Prime Therapeutics in October of 2023. And we officially kicked off this project on November 16, 2023. From day one, our shared goal has been to create a modernized, efficient, and transparent system for NC Medicaid Direct without losing the operational rigor and control that providers and pharmacies depend on. This implementation team brings together truly a cross-functional group of experts, which includes a product manager, business lead, pharmacists, project managers, integration specialists, and quality assurance analysts. Each discipline plays a critical role in the design, development, testing, validating, and ultimately the implementation of the new Prime PBA system that meets both CMS requirements and the unique needs of North Carolina. The work that they are doing is not simple. We are transitioning over a decade, that's right, over 10 years of claims, PA, provider, and member data from our legacy NC Track system that has been the foundation of NC Medicaid pharmacy operations since 2013 into a new PBA environment operated by Prime. This requires meticulous planning, testing, validating to ensure every rule, every edit, every policy, and every clinical workflow transfers accurately. Their work is what allows us to confidently move forward towards our May 2nd launch, and I'm incredibly proud of everything the PBA team has accomplished. We can go to the next slide, please. Now, this brings us to a very important question. What exactly is NC Medicaid bringing on to administer the Medicaid Direct Point of Sale Pharmacy Program? We reviewed this in webinar 1, but it is so important we need to cover it again. NC Medicaid is not transitioning to a BBM. We are implementing a PBA, which is the dark blue box on the left. A PBA is responsible for managing the administration of certain aspects of the drug benefit for a payer, but typically does not provide the full suite of services offered by a PBM. For example, in Medicaid context, the state already establishes reimbursement rates, defines clinical criteria, and sets policy. The PBA's role is to process and pay prescription claims in accordance with the established rules. In other words, the PBA executes the operational components of the pharmacy benefit without dictating policy or pricing. In contrast, a PBM, shown on your right, oversees the entire pharmacy program and exercises broader control. PBMs develop and manage formularies, establish reimbursement methodologies, negotiate prices and discounts with the pharmaceutical manufacturers, and define their own pharmacy network. Additionally, PBMs may implement cost containment strategies such as spread pricing and retrospective cost adjustments, mechanisms that can significantly influence overall program cost. This is not the model NC Medicaid is implementing. Under North Carolina's new PBA model, Prime Therapeutics will perform several key functions, including point of sale claims processing, formulary management, drug rebate administration through the federally authorized Medicaid drug rebate program, drug utilization review, prior authorization administration, PHP lock-in program oversight, reporting and analytics, member services, and specialty pharmacy support. This approach allows NC Medicaid to maintain full control over policy, clinical criteria, the PDL, and reimbursement decisions, while leveraging the PBA's operational expertise to ensure accuracy, efficiency, and compliance. You can go to the next slide, please. This slide helps us visually see the current role Prime plays today and the new role that Prime will play when the PBA goes live on May 2nd. It is important to note that Prime Therapeutics is not new to the state of North Carolina. Prime has been working on NC Medicaid's behalf behind the scenes as a subcontractor of NC Tracks for over 10 years. Let's first look at the diagram on the left. The inner circle is the function that NC Tracks does today for Medicaid Direct, including point-of-sale pharmacy claims, processing, prior authorization, provider services, lock-in, finance, transition of care, pharmacy web portal, and call center. If we now look at the outer half of that same circle, these are the integrated systems that connect with the pharmacy benefit today. We can draw our attention to the red segment on the left labeled Prime. For the pharmacy program, today Prime is providing drug rebating, prospective and retrospective DUR, and PDL management through their subcontract with GDIT. Now, if we look at the right diagram after the transition, this is the future state come May 2nd. Many of the functions that NC Tracks was completing are now being complete by Prime as a new PBA vendor, including Medicaid direct point of sale pharmacy claims adjudication, prior authorization, a dedicated call center. And now if we look at the outer segment in gold, this is the functions that will be retained in NC Tracks for the pharmacy program, including finance, provider enrollment, transition of care pharmacy claims, and transition of care lock-in. I will now hand it over to Amy to go over our pharmacy committees.
Thank you, John. Hello, everybody. My name's Amy Williams-Phelps. I'm one of the pharmacists at Medicaid. And for this slide, we'll talk just a little bit about some of our pharmacy committees. Some of you on the phone may have listened in or even participated in some of these committees in the past. So we'll talk just a little bit about them and how they will look once we go live with Prime. North Carolina Medicaid's pharmacy committees include the DUR, which is Drug Utilization Review Board, and the PDL Review, which is the Preferred Drug List panel meeting. These processes have been in place for over 10 years. They meet quarterly. They are an integral part of our program's clinical governance. They will continue to operate as they do today. They will not change when we go live with Prime. The state maintains the full clinical oversight, with Prime supporting from an operational and administrative perspective, just like they have helped us in the past. The DUR, or Drug Utilization Review Board meeting, these activities are performed by the board. This will remain unchanged. The prospective DUR, which is also called ProDUR, edits will be implemented in the point-of-sale system, just like we have them with NC Tracks. They will be administered by Prime going forward. Prime is the state's current vendor performing retrospective DUR, which is also called RetroDUR activities, which is a large part of what we talk about at the DUR board meeting. The Preferred Drug List Review Panel, the PDL Review Panel, was established to conduct routine open meetings to discuss recommended changes related to placement of drug products on the PDL. These meetings are quarterly. They consist of a PDL panel, which has physicians and pharmacists that are on the panel, and anyone can register to speak at these meetings. The public can speak, providers can speak, anyone with an interest in what's happening or where these drug placements may be for that particular quarter are invited to speak if they would like. The existing PDL review structure and the clinical decision-making remain unchanged after we go live with Prime. In fact, Prime has already been helping us with the PDL. They are the current state vendor, and they will continue to support the PDL like that they have in the past. I will turn it over now to Raina for the next slide.
All right. Thank you, Amy, and good evening, everyone. My name is Raina Barlawala. I'm one of the product integration specialists on the PB implementation team. And I'm going to walk you through where we are and where we are headed with our Medicaid enterprise system work. So the MES initiative started at the federal level back in 2011, when the CMS set the expectation for the state to modernize their Medicaid system and move towards a modular, well-connected technology framework to modernize and replace the legacy Medicaid Management Information System, known as MMIS. So the North Carolina launched the Medicaid Integrated Modular Solution, known as MIMS program, to gradually replace the aging Medicaid technologies, primarily known as NC Tracks, which has been running since 2013. By shifting to a modular approach, it gives us the flexibility to integrate with a more effectively, respond to policy change faster, and introduce improvement easily. So now where we are heading is a fully modern, modular Medicaid ecosystem, one that is more agile, better positioned to support providers, members, and state. So the goal is to have a flexible ecosystem of the modules that can be updated independently and integrated seamlessly with the internal and external partners. MIMS aligns with the MES guidelines and delivers the key advantages, including better alignment with NC Medicaid business operations, improved interoperability with the providers, vendors, and partners. This is a shift from a monolithic system to a modular, agile, vendor-supported architecture. With this ability to adopt new capabilities without a large-scale system overhauls. And throughout this transition, NCMIS ensures continuity between the legacy environment and the new MIMS module, so the operation remains stable. Let's go to the next slide, please. Okay, so this is a slide list all the challenges the department is experiencing with the current system, and as well as the opportunities that come with the new PBA system. The vision for the new PBA focusing on modernizing its core IT system, which were originally built on a monolithic structure and frameworks. This incremental modernization will reduce size, complexity, while improving long-term sustainability across the PBA system. So by modernizing the PBA solution, we will be able to provide a single pharmacy benefit administrator system that improves compatibility and coordination between technical partners through timely and reliable methods. It will also support efficient management of the single state preferred drug list known as PDL. It will also help us maximize drug rebate collection for the state with improved rebate handling across the Medicaid and managed care plans. This will also advance drug utilization review to support safer, more effective, and medication use. It will also deliver enhanced pharmacy lock-in functionality. And that will be all from my end. I will pass it to Susan. Thank you.
Thank you, Rena. I'm Susan. I'm one of the pharmacists in the implementation team. Today, I'll be covering no changes for managed care members. As we move towards the new PBA go live, it is important to clarify that this transition affects Medicaid direct point of sale pharmacy only. Managed care plans are not impacted by the new PBA implementation. Managed care plans will continue operating exactly as they do today. Their PBMs will remain the physical agents for pharmacy benefits, and they will continue paying pharmacy claims for their enrolled members. There are no changes to claims processing, provider workflows, or the member experience for managed care. Transition of care processes remain unchanged. Managed care members will not experience any disruption or differences in how their pharmacy benefits are handled. All system and operational changes apply only to Medicare Direct, beginning May 2nd, 2026. And now I'll hand it over to Jane. Thank you.
I think you're on mute, Jean.
Sorry about that. Thank you, Susan. My name is Jean Matthews. I'm one of the PBA Business Integration Pharmacists. Let's take a moment to walk through what this transition specifically means for NC Medicaid Direct beneficiaries. I'll start on the left with what is changing. First, Prime Therapeutics will become the pharmacy benefit administrator for NC Medicaid Direct. So they'll be supporting things like claims processing, prior authorizations, and call center operations. You'll also see that prior authorization history, both approved and denied for the past 10 years, will be transitioned over. That's important because it's going to ensure continuity and access to historical records when needed. Another key change is at the pharmacy call center. This will be now operated by Prime Therapeutics. And one of the benefits here is that we will have expanded support available 24/7, 365 days a year, which should improve access for beneficiaries needing assistance. Now shifting to the right side, what's not changing? This is really important. The transition only impacts NC Medicaid Direct beneficiaries. It does not affect members in managed healthcare plans. There's no interruption to coverage or access to medications, Beneficiaries can continue using their current Medicaid cards. There's no action required on their part, and there's no need to switch pharmacies or update their information. Prescriptions are going to continue to be filled the same way, and the transition of care protections will remain in place. So overall, while there's some administrative and support changes happening behind the scenes, the experience for beneficiaries is designed to remain stable and uninterrupted. We can move to the next slide, please. Now let's shift gears and talk about what this transition means to medical providers. I'll start again on the left side with what is changing. So beginning May 2nd, pharmacy prior authorizations will be managed by Prime Therapeutics, and submissions are going to be routed through tools like Cover My Meds. So from your perspective, this means updated workflows for how you submit and manage prior authorizations for medications covered under NC Medicaid Direct. You'll also see additional support resources becoming available, including a dedicated call center to help with medication-related questions. Along with that, there will be updated training materials, provider guidance, and reference tools to support these new prescribing workflows. And importantly, medication-related workflows that may have previously gone through NC Tracks will now transition over to Prime. Now on the right side, what's not changing? NC Medicaid Direct beneficiaries will continue to receive their pharmacy benefits without interruption. Your prescribing practices and clinical decision-making are going to remain exactly the same. This transition does not change how you care for your patients. The preferred drug list and DUR board oversight continue as they do today, and the state maintains full control of the pharmacy benefit. Prime is just supporting administration and not replacing the state oversight. So from a claim standpoint, the BIN and PCN remain the same. There's no change there. Member eligibility, enrollment, provider participation requirements, and reimbursement methodology are also not changing. So the big picture here is this: while some of the administrative pathways and tools are evolving, the clinical side of what you do and how patients receive care remain consistent. Now we're going to shift focus to what this transition means specifically for pharmacies. I'm going to hand it over to Coffee, who will walk you through the key changes and what to expect at the point of sale. Thank you.
Thank you, Jane. Good evening, everyone. My name is Kathy Obong, and I'm a business integration pharmacist on the PBA implementation team. I'll be going over the slide here, which outlines what pharmacies need to know about the upcoming transition on May 2nd, 2026. We specifically want to highlight for you what is changing versus what isn't changing, just as Jane has previously gone over. So let's go over what's changing first. So beginning on May 2nd, all North Carolina Medicaid Direct pharmacy claims will be routed through Prime Therapeutics. NC Tracks will stop processing the point-of-sale pharmacy claims just before midnight on May 1st at 11:45 p.m. Prime will then begin accepting claims shortly after at 12:15 a.m. on May 2nd. This will ensure that there is only a 30-minute brief transition window. Also, PBA operational changes will include some of the following. Accessing pharmacy information and services will be via a Prime-managed pharmacy provider portal, a new pharmacy provider dedicated call center that is now going to be open 24/7, 365 days a year. There will be additional means of submitting prior authorizations through an EPA platform called Cover My Meds. And lastly, on the side of what's changing, there will be clinical operation services switching from NC Tracks to Prime. Some of those would be things like prior authorization services, PDL administration, DUR administration, and our lock-in program administration. Now let's look at what's not changing. This transition impacts only the NC Medicaid Direct beneficiaries, so there is no impact to members enrolled in North Carolina Medicaid Managed Care Health Plans. There are also no changes to pharmacy claim submission. So aside from the new routing of the claims to Prime, pharmacy workflows at the point of sale will remain the same. Of note, as Jane just mentioned, there are no changes or updates to the BIN and PCN numbers at Go Live, and pharmacists can continue to use the exact same values as they use today. Additionally, there are no changes to pharmacy participation requirements or enrollment status. Everything on the provider side continues as it does today. Altogether, while the claim processor is changing behind the scenes, operational impact to pharmacies was intentionally left minimal. Next slide, please. Thank you. All right, so now let's talk about payment and remittance advice after the PBA go live. The most important thing for pharmacists to understand is that nothing changes with how payment or remittance advice information is handled today after the PBA go live on 5/2. NC Tracks will continue to operate as the fiscal agent for all financial processing, including the processing of remittance advice. NC Tracks will still generate both the electronic RA and paper layout for all claims and financial activity for each payment cycle. Then pharmacies will continue to find both the electronic 835 file and the paper style RA layout in the provider message center within the NC Tracks Provider Portal, just as they did today. From a payment standpoint, providers will keep receiving their EFT or check for each remittance with a positive payment amount through the same fiscal agent operations that is already in place. Again, that's NC Tracks. So even though the PBA system introduces new tools for reviewing your process claims, the financial side remains unchanged and continues to run through NC Tracks. I'll now turn it over to Kelly with Prime.
Thank you, Coffee. So my name is Kelly Schweitzer. I'm a pharmacist with Prime Therapeutics on our North Carolina team, and I'm excited to walk you through what our Prime team has been working on with the state. Next slide, please. So here's our Prime team who is working on North Carolina. Myself, Leslie Pittman is our Senior Director of Account Management. Precious Sweeting is our account manager who's dedicated to North Carolina. And then Julie Brown, who you will hear from later, is our Director of Education and Outreach for North Carolina. Next slide. So just an overview of some of the most important details for our pharmacy benefit transition. First, effective May 2nd, 2026, all pharmacies must submit their NC Medicaid Direct pharmacy claims through Prime's pharmacy system. NC Tracks will no longer process Medicaid Direct point-of-sale pharmacy claims after Friday, May 1st. And there's going to be a window of scheduled downtime from 11:45 p.m. on the 1st until 12:15 on the 2nd so that we can transition from NC Tracks to Prime PBA. In support of a seamless transition, Prime will be maintaining the existing BIN and PCN currently used by NC Tracks at Go Live. No action is required from pharmacies related to BIN and PCN changes. In terms of claim submission requirements, Prime will need the date that the prescription was written to reflect the original prescription date. We will need the date of service to reflect the actual dispensing date. And then coordination of benefits, COB, and CPDP standards will be applied to all claims. And claims will deny if required COB values are missing or invalid. Point of sale claims are typically submitted at the time of dispensing. And so when submission occurs after dispensing, timely filing limits will apply. So for original claims, this is 365 days. And then for reversals, also 365 days. And for rebuild claims, there's a timely filing limit of 18 months. Claims submitted outside these windows will deny with NCPDP error code 81, timely filing exceeded. Next slide, please. So what has changed? The major thing is that starting May 2nd, NC Medicaid Direct pharmacy benefits will transition away from the NC Tracks platform to Prime Therapeutics. Next slide, please. There's a couple things that we want to highlight in terms of claim submission differences also, and additional details on these can be found in the NC Medicaid Direct Provider Manual and on our NCPDP Payer Specification Sheet. Next slide, please. So walking through some of these changes that will be effective starting May 2nd. First, in terms of DUR conflict codes, claims must include all applicable DUR conflict codes on the claims. So NCPDP field 439E4, the reason for service code, field 440E5, the professional service code, and field 441E6, the result of service code. And additional details on this are spelled out in section 10.2, the Pro-DUR alerts and overrides in the NC Medicaid Direct Provider Manual. High dose edits. The system checks for high dosage by comparing billed units and days supply against FDA-approved limits. Claims exceeding allowed limits are going to deny with 88 DUR reject error. To override this denial, providers must submit the appropriate DUR codes confirming that the billed units and days supply are correct. And again, there's more details in section 10.2 of the NC Medicaid Direct Provider Manual. PA type code 2 and SCC2 will no longer override high dose edits. State of emergency. When a state of emergency has been declared, pharmacies can submit a submission clarification code of 13 for emergency. A prior authorization type code 09 will no longer be used for the state of emergency. Next slide, please. For coordination of benefits, NCPDP COB standards will be applied to all claims, and as we reviewed a couple slides back, claims will deny if required COB values are missing or invalid. Providers must follow the required fields outlined in the payer specification sheet. Days supply. Policy-defined limitations will be adhered to. Claims submitted outside of these limitations will deny. 76 plan limitations exceeded. More details on this are in section 6.3.1, dispensing quantity limitations in the NC Medicaid Direct Provider Manual. Immunizing pharmacists. Claims submitted for protocol products will no longer be accepted if the pharmacy service provider's NPI is used in the prescriber ID field. These claims will reject. Immunizing pharmacists must meet all applicable requirements and be registered as an immunizing pharmacist with the NC Board of Pharmacy. And just as a note on this one, both before and after May 2nd, immunizing pharmacists must also be actively enrolled as an NC Medicaid provider. For compounds, a change is that claims submitted as a compound cannot contain the same NDC more than once. For the date of birth field, the beneficiary's date of birth submitted on the claim must exactly match the date of birth on the beneficiary's demographic record. Otherwise, the claim will reject 09, missing invalid date of birth. And then finally, gender. The beneficiary's gender submitted on the claim must match the gender on their demographic record. If there is a mismatch, the claim will reject with error code 10, missing invalid patient gender code. Next slide, please. Pharmacy testing has been successfully completed. Our testing window ended last Friday on April 17th, and we just wanted to thank all of our pharmacies who participated. We had great turnout and got a lot of valuable feedback from our testing window, and so we just really appreciate everyone participating and helping ensure that this transition is as successful as possible. Next slide, please. Payer sheets. So these will be available online in early March at North Carolina _D0_payer_specs. The payer sheets outline required claim submission fields, transaction requirements, and billing specifications for NC Medicaid Direct pharmacy claims. Pharmacies should coordinate with their software vendor to ensure system updates are completed prior to the 5/2 go live. Next slide, please. Prior authorization submission. So through Prime, there are going to be several routes for submitting prior authorizations. Beginning May 2nd, in addition to processing pharmacy claims, Prime will also process prior authorizations for NC Medicaid Direct beneficiaries. There is no change to PA submission for beneficiaries enrolled in managed care plans. Those requests will continue to be submitted to a beneficiary's applicable health plan. Prior authorizations for Medicaid Direct will be processed 24/7 and may be submitted via one of the following routes. So first, we do have a phone call center at 844-620-6116, and that's available 24 hours a day, 7 days a week, 365 days a year. Web support via the PBA Pharmacy Provider Portal and selecting the Pharmacy Benefit Administrator tile is available Monday through Friday, 8 a.m. to 8 p.m. Eastern. Prime also maintains a fax line at 866-422-8981 and a mailbox at Prime Therapeutics State Government Solutions, LLC, attention GB, P.O. Box 64811, St. Paul, Minnesota 55164. And finally, we do have EPA through Cover My Meds, and this is also accessible via the secured provider dashboard of the Prime PBA Medicaid Pharmacy Portal. If a PA is timed out during our scheduled system downtime from 11:45 p.m. on May 1st to 12:15 a.m. on the 2nd, the pharmacy can resubmit that prior authorization to Prime after 12:15 on the 2nd. And one thing that's important to note, existing and historical NC Medicaid Direct prior authorizations will automatically transfer to Prime in advance of the 5/2 go live. So if you do have beneficiaries with existing prior authorizations, those should transfer directly to Prime without any additional action required. Next steps, please. Next slide. Pharmacy payment information. So NC Medicaid Direct will still be supporting all inquiries regarding check write, remittance advices, manual claims, check and payment information, and they will be handled by the North Carolina Medicaid Contact Center at 1-888-245-0179 or online at nctracks.nc.gov. Next slide, please. Contact information and resources for Prime Therapeutics PBA, for pharmacy claims, PA, and web portal support starting May 2nd. Again, our call center number is 844-620-6116, available 24 hours a day, 7 days a week, 365 days a year. Web support will be Monday through Friday, 8 a.m. to 8 p.m. Eastern, and then our fax number will be 866-422-8981. Next slide, please. The North Carolina Medicaid Contact Center will also support provider enrollment and check write remittance inquiries, and it is at 888-245-0179 or online at nctracks.nc.gov. Next slide, please. For our pharmacy providers training, I will turn this over to Julie Brown.
Thank you so much, Kelly. Good evening, everyone. I'm Julie Brown, Director of Education and Outreach with Prime Therapeutics. And as it relates to pharmacy providers training, some information here. Prime, we've provided training videos to support pharmacy providers in preparing for the transition. This flexible format allows pharmacies to complete training prior to go live. We have training videos and supplemental materials that is available currently on the North Carolina Pharmacy Provider web portal. And providers are encouraged to complete training prior to go live. The two links are available in purple to the training videos. And then also as it relates to provider readiness, NCD, HHS, and Prime, we've hosted two, which last month, I believe we had a webinar, and then as we are here today, provider webinars to review the transition and address additional questions prior to go live. And following today's webinar, you will receive a link to the recording and a survey. And if you can go ahead and complete the survey, we would appreciate it. Your feedback is appreciated. Additional training information, recordings, and updates will be made available as we approach our May 2nd, 2026 go live date. Next slide, please. All right, we'll now talk about the portal, not in detail. I have a colleague later who will demonstrate for you, but talking about the North Carolina Medicaid MES landing page and North Carolina Medicaid Pharmacy Portal. If we can go to the next slide, please. Okay, so beginning on the 2nd of May, pharmacies will access the NC Medicaid Pharmacy Provider Portal through the MES landing page, which we have here an image for you. If we can go to the next slide. And which then will bring you to the North Carolina Medicaid Pharmacy Portal. Just a snapshot for you. Again, we'll go into further detail later with our demonstration. You can go to the next slide. And then effective May 2nd, some of the portal supports will provide pharmacy operational functions and then also resources. Just to bring to your attention, our PA forms will be listed or provided to you under the resources tab under forms and documents. And so here we have a list of different functions, drug lookup tool, drug recall information, a plethora of resources available to you so that we are all successful with the go live here on May the 2nd. And if we can go to the next slide, please. I'll now turn it over to Kim Phelps, who will demonstrate the provider portal for you. Thank you so much.
Thank you so much, Julie, and good evening, everyone. I'm going to share my screen. If someone can just confirm that they can see once I get it up here.
We can see it.
Thank you. So as Julie mentioned, I'm Kim Phelps. I'm a solution product consultant with Prime's digital experience team, and I'm going to walk you through a demo of the North Carolina Medicaid Pharmacy Portal. I'm highlighting the features you can expect to access when navigating the site. This pharmacy portal is designed to support pharmacy providers through an integrated, connected experience, and will also provide you with a public-facing view that is available without the need to log in. But to access the North Carolina Medicaid Pharmacy Portal, you will be required to log in and authenticate by starting here at the North Carolina Medicaid Enterprise System Portal. And I'm going to be required to enter in my password, and it is going to then prompt me to receive a token on my mobile device and be authenticated. Once I am authenticated, I arrive here at the MES landing page. I am going to select the PBA Pharmacy Provider Portal tile. And what you're seeing right now is our secured sign-in through Okta. And once I'm authenticated and logged in, again, I will land at the provider dashboard. If you are a provider who is associated with more than one NPIs in your profile, then you will need to select which NPI you want to work with, and then select Submit. And then you will see that you are successfully landed on the provider dashboard, where you'll see a welcome message, whom you are working on behalf of. Again, you can see those available NPIs that you can work with here in the dropdown. And then you're going to see 4 tiles. There is a member eligibility inquiry tile, where we'll go into that to view member benefits as well as claim history, and you'll be able to confirm coverage. There is a web claim submission tile, which will provide access to an external web claim submission application for electronic claims. Prior authorization will take you out to Cover My Meds, where you'll be able to submit authorization requests. And then for those delegated admin users, you will see a user admin console tile, which we will get into here in a little bit as well. So I'm going to focus here in the menu. You have two menu options. You have a tools and a resources option. If I select tools, then I'm able to perform a drug lookup where I have two ways that I can search. I can search by drug name or I can search by NDC. This is a smart search. So as you type, you will be presented with a list of available drugs based upon the information you have input. And then as long as, again, that is a valid entry, you should yield search results that will provide you with the NDC, the drug name, the manufacturer, the generic name of that drug, over-the-counter requirements, PA requirements, if it's on the preferred drug list, and then there's also a rebate indicator. Also within tools, you can find a pharmacy. This will allow you to search for local pharmacies. I'm just going to put in very generically the city. I can do a 5-mile search, 1, 10, 15, or 20 miles from the address I put in. And then it's going to provide a list of pharmacies based upon my search parameters. And I can select more info where you can see distance, the phone number, the address, the hours of operation, and then the services that are offered at that pharmacy. Moving over to the resources menu, you have the ability to view announcements. We'll look at Contact Us, drug recalls, frequently asked questions, forms and documents. There's some helper utilities as well as some links. So we will start with announcements. And these announcements are providing you all with information that's new or important, such as notices, policy reminders, or any time-sensitive information. There are hyperlinks where you can view more information. A side panel will open, and if there is even further information to review, you can select the hyperlink here, where you will be presented with that document, or it may take you to another link externally. Contact Us. This page does provide you with Prime Therapeutic phone numbers for support. There's the fax number, PDL fax number, provides the call center hours of operation as well as web support hours. And then there is an online form that can be filled out and submitted. Drug recalls will provide you with a link that takes you to the latest drug recalls. And each of these are expandable, so you can drill down into more information there. Forms and documents, again, provides you with important forms and documents. We will have PA forms out here as well as some other documents that are accessible to you. And just by selecting the form or document that you would need, that is going to open up in another tab and you're able to view that, print, or download. There is a helper utilities page. So these are plugins that you may need to provide assistance with viewing the site, for instance, Adobe or any one of the many popular web browsers. And then there is a links page, again, that provides links to various information. There's demos out here that have been done previously. There are other links that provide other information that may take you externally back to NCDHHS, or there's actual notices that will open directly within your web browser to provide you with additional information. There's also the ability to search, and there's also a language toggle The other language option that we have available right now is Spanish. I'm going to select log out here just to show you that once logged out, this is the public facing view. So as I mentioned, you do not have to be logged in to access our public facing portal. And you still can use drug lookup. You can find a pharmacy right on this home page. You can also see announcements on the home page, but the tools and the resources menu are still available. I'm going to close out some of these tabs, and then I'm going to log back into the dashboard. I'm going to walk through the member eligibility inquiry tile, and then I'm going to turn it over to one of my colleagues to walk you through web claim submissions, and then another colleague will walk you through the user administration console. Under member eligibility, once selected, you can enter in the member information, the date of birth, and here you will land on the demographics tab, where it's going to provide the name, date of birth, the status of the policy, the gender, that member ID number, the service date, which is today. And there's some other information here that, if applicable, may or may not be populated. There is a tab for eligibility history, and then there's also a tab for claims history, where you'll be able to see service date, the RX number, the drug name, who the prescriber was, the pharmacy, the amount paid. You will be able to see a paid date for claims that were paid. And then if you drill down into here, you'll be able to see the day supply and the quantity as well. So that is all for my demonstration. I am going to turn it over to Frank, and Frank is going to walk you through the web claim submission process. To access web claim submission, you would select this web claim submission tile, and then it will land you on the web claim submission screen. So this is where Frank will pick it up. Thank you.
All right. Good evening, everybody. My name is Frank Cardacia, and I am a Principal Benefit Configuration Advisor for Prime Therapeutics. And today, just going to go ahead and give you guys a brief overview of the web claim submission template in regards to what fields, or the layout rather, of the screen for what D.0 fields will be presentable to you for the information that you have to enter to submit claims to us. So once you log in and access the web claim submission guide, my template section here is a little more robust because I'm logged in under me. But for your provider login, you're going to have access to 3 particular templates identified down here: web claim version D.0, rebill, and reversal. So for demonstration purposes, we're just going to do a very simple non-COB, non-compound claim, just to show you what kind of information has to be present here, and run it through as a reversal once we get the response. Okay, so this screen that comes up here gives you a pretty brief overview of what's laid out here. So each field, if you submitted claims, obviously you are pretty familiar with a good chunk of these fields as they are. The layouts here are grouped, defined as so. So we have the header segment, which we have our BIN and PCN. Those are locked in place, so you don't have to worry about entering anything here. The service provider ID, in your case, once you log in for or whatever MPI you select, will be locked in. at this point. So for testing purposes, I'm just picking an NPI as so. The date filled or the date of services of this particular claim. As we can see here, it's in 2-digit month, 2-digit day, and 4-digit year format. Patient segment, date of birth, same principle, 2, 2, and 4. The gender code, which as was indicated before from my colleague Kelly, that the incoming gender code has to match whatever it is on the eligibility file. First and last name for the patient. And not necessarily mandatory fields, but optional out there. Pregnancy indicators for certain edits pertaining to pregnancy or patient residence codes there as necessary. And then finally, the cardholder ID. The next segment then goes into the meat of the claim, starting off with the prescription number. So we're just going to pick something there for safekeeping. The product service ID. So for a non-compound claim, we're just going to pick something very simple, cephalexin capsules. Quantity dispensed. Again, we're just going to pick something random for 30. The refill code in this case, 0 would imply that this is a first fill on the RX number. 01 would be the first refill, 02, 03, so on and so forth for any other subsequent refills. In this case, we'll just say it's 0, the day supply of this claim. So we'll call it 30 as well. The indication, if it's either not a compound or a compound, your dispenses written code. So we're going to go 0 in this case. Date written obviously has to be on or before the date of service. So we're going to pick 4/16/2026 yet again. The number of refills authorized. So we'll just say 5 just for safekeeping. The prescription origin code, the way in which this prescription came in, we'll say it's a written prescription. Quantity prescribed, that field can be left empty in this particular case because it's not a Schedule II medication. Other coverage code, we're going to declare it's not a COB claim, so another coverage code of 0. Unit of measure, you have to select between each is grams or milliliters. Since these are capsules, they are measured in terms of eaches, so that has to match. Additional fields that are voluntary in this case, whether it be level of service to indicate that it's an emergency, PA type codes if those were present, routes of administration, which are identified for more particularly for compound medications. These are called SNOMED codes. And that's really it for that. Submission clarification code, if it's necessary. If you're a 340B pharmacy, this would be where you would utilize submission clarification code 20 or any of the other submission clarification codes, whether it be a therapy change or a vacation supply or a lost prescription. Just going to show in this quick case that you do actually have a little arrow button over here where you have the ability to utilize multiple submission clarification codes on a single claim. So just a little safekeeping thought on that. Prescriber segment. The only thing we need from the prescriber in this case is the prescriber NPI. COB segment. Again, since this is a non-COB claim, none of this information is truly necessary at this time. If you are utilizing other coverage codes 2, 3, or 4, there are appropriate NCPDP fields that are required depending on which code is submitted. So such in the case, if you submit with an other coverage code of 3, indicating that the primary rejected the claim, you pass then to us the other reject code that the primary sent back via here. Patient paid amount, what the primary picked up, if it was an other coverage code of 2. And then the patient responsibility amount, or essentially what is remaining left on that claim after it's gone through any other primary or secondary insurers. The DUR segment here, Should be pretty self-explanatory for those who have to deal with DUR rejects. You have your reason for service code, your professional service code here, your result of service, and you also have the ability to utilize, again, multiple response codes for each one. Pricing. So this is really the only other mandatory field left. So the ingredient cost submitted, we're just going to say for kicks, $10. Dispensing fee submitted, $5. For our usual and customary of $15. Gross amount due of $15. Basis of cost determination is indicated based on your ingredient cost submitted. We're just going to pick just 0-1 in this case. 340B pharmacies, to note, this is where you would select basis of cost 8 for your claims. Compound information, where you would identify each ingredient in the compound at an NDC level, the quantity and the cost. And then finally, a small clinical segment where you can identify if an ICD-10 code is on the claim, or I'm sorry, on the script rather. You can punch that in here. Again, you have the ability to, oh, come on, what's this doing? A little lag here, sorry. Just picking something for kicks. You have the ability to utilize multiple ICD-10s on a claim if necessary. So once you have all your information populated, you hit submit claim. Then take you to your claim response. And if everything goes well, fingers crossed. I think I'm missing invalid birth date. Let's see. So we can go back real quick based on that response. Make the change. Yes, and I meant to do July 30th, 1960 as opposed to July 3rd. And just go back and then resubmit. Fortunately, all the information is there retained, so you can just change what needs to change. All right, so as we can see here, we have a paid claim response. We see the patient paid amount indicated as or as the patient copay, the ingredient cost of the dispense fee, and the initial total amount paid that is for reimbursement at that point of processing the claim. So if you then want to just simply reverse this particular claim, at the very bottom of the screen, we have a little button here to reverse said claim. By doing that, it kicks back another window now, just telling you that this reverse has been processed and we're good to go. So again, very simple, I hope, for the most part. Any questions or concerns, by all means, throw it into the chat and we'll address it as soon as we can on that. So with that, in turn, I will hand it now off to Laurent for UAC. Thank you.
Thank you, Frank. Get my screen up here. My name is Laurent Thibault. I'm the Global Administrator for UAC for Prime Therapeutics. I'm going to be walking you through the UAC console tonight. What the UAC console is it's an application that allows providers to self-manage their access through portals and applications within the Prime Therapeutics network. There are two types of users within the UAC space: delegated administrators and standard users. Delegated administrators are users that have gone through the North Carolina process and have been authorized to manage users on behalf of their org ID or MPIs that they have been registered for. User accounts that the delegated administrators create are called standard users that do not have any administrative access or access to the UAC tile. They access the tile by clicking it, logging in through the MES portal and onto the North Carolina landing page, and then get to the tile here. If you have access, you will see the tile. Kim had indicated earlier. Click the tile. It's going to go through login. Because I think I timed out. Got to put my OTP back in. want to take my time. Always when I present, always. There you go. It will go through the Octave validation, which is in the background, and take you to the user management page of UAC. What this will do is it will list every user that is that you have MPIs authorized for. It will list any of the users that have access to those MPIs on this screen. So you may see if you have multiple MPIs, like if you have 3 or 4, you will see users that you necessarily may not have created, but they're on this tile because you can administer them. I should say that delegated administrators are not allowed to do changes or update other delegated administrator accounts. They are allowed to view, but not see, not change. So to create I'm going through this very fast, sorry. To go through the add new user process, to add a new user for it, you click the blue button here. You put the NCID in of the user you want to import from NCID. You do have to know their NCID number or login name. Click submit. What it will do is it'll go to the NCID system, look up that user, pull back the information if it finds it, and populate this user demographic screen. Do note this is not editable. All the edits that need to be done on the NCID side prior to import. So we've got this user, we're going to submit. It will take us to the orgs and roles screen. What this screen is, it allows you to actually make the assignments to the applications at portals and other resources that you've been authorized for. It will list all the org IDs that you have access to. So you may have multiple, and if you do, you can select them one at a time and then make assignments down here to the applications that you have, which is Pharmacy Web Claim Submission and the Secured Provider Portal. Do note that the Secured Provider Portal for all standard users is automatically assigned. So you do not have to worry about that, even though it doesn't appear over here. If you assign the MPI and you just click save, you will see that it will update, automatically assigning that role. So if I wanted to assign web claims to this user, this test account user, I would go down here, select the web claims application, click the checkbox in front of the role I wish to assign, and click save. This status box to the right will update, and it will show you all the roles currently assigned to that user for this MPI. Now, if I wanted to assign them to another MPI, I could just select that, do the same exact thing I just did, clicking the checkbox and clicking save, and you'll see they'll update. So now this user has 2 assignments, one for Pharmacy 1 and one for Pharmacy 3, both with web claims access and secured web portal. Administrators also have access to what's called the Organization Management tab. When they click this tab themselves, they will see all their org IDs they have access for, and they can click the checkbox in front, and what the system will do is populate a grid below. They'll show a list of all of the users assigned to that org ID for which they have authority and their role. Users that are delegated administrators have a green double person icon on them. And that's pretty much it. We look forward to working with you. And with that, I'll turn it over to Kathy.
Thank you, Lauren. I will be going over the next section of our presentation here, which in this section, we'll be going over the questions that we received from the first webinar. I'll be hosting the questions and different people will chime in and help answer those questions. So the next slide here. Okay, our first question here is, after the PBA goes live, who will be responsible for issuing payments, and will pharmacies receive remittance advice from Prime? Raina, can you take that question for us? All right, Raina, you might be speaking on mute. All right, I can go ahead and take this one.
Sure,
Oh, there
Kathy.
you
I
go.
was trying to get off my mute.
Thank you, Raina. You can go
Yes,
ahead.
thank you so much, Kathy. So the question is, after the PBA go live, who will be responsible for issuing the payments? And will pharmacies receive remittance advice 835 from the Prime? The answer is yes. The NC tracks will continue to be the fiscal agent operation for the finance processing, including remittance advice. NC tracks will continue to issue the payment to the all pharmacy providers and provide pharmacy remittance advice 835. All inquiries related to the remittance advice RA will also continue to be handled by NC tracks. So provider may contact, the phone number is 1-800-688-6696, or they can go to nctracks.nc.gov. Thank you.
Thank you very much, Raina.
Mhm.
All right, our next slide here. Our next question is asking, how should electronic prior authorizations be submitted to Prime through the portal dashboard or via Cover My Meds? Kelly, would you like to take that for us, please?
Sure, thank you, Coffee. So EPAs can be submitted directly through Cover My Meds. And a few important points to know. Cover My Meds is the preferred method for EPA submission. Providers do not need to use the portal dashboard to initiate or complete EPAs, but the portal may be used for status checks or additional information if needed.
Thanks, Kelly.
Sure.
All right. Next question here. Will the EPA solution work with SureScript integrated EHR systems? And will providers be able to submit and manage prior authorizations directly within their existing EHR workflows? And Kelly, if you don't mind, can you take that for us as well?
Yeah, I can take this one. So the answer is yes. The EPA solution will support SureScript's integration and can be accessed through participating EHR systems, allowing providers to submit and manage PAs within their existing workflow. Availability may vary by EHR vendor, so this may be something that would be good to check in advance of 5.2.
Thank you, Kelly. All right, next question. Can I rely on my EHR or e-prescribing system to determine if a medication requires prior authorization? And Amy, can you take that question for us, please?
Sure, I'll take this one. The answer is no. While the EHR and the e-prescribing systems can be helpful, they may not reflect the most current North Carolina Medicaid direct policies. So providers should confirm prior authorization requirements using the official North Carolina Medicaid direct resources, which can be found on the Prime Pharmacy Provider Portal.
Thank you, Amy. All right, next question here is, if a prior authorization is denied, can it be resubmitted or is an appeal required? Amy, can you help us with this as well?
Yes, I'll take this one as well. So if a prior approval is denied, the request can be resubmitted if additional information is available or if something was wrong and corrections are needed. The denied prior approval can also be appealed through the appeals process. And that process is located in the letter that the beneficiary will receive, and that the doctor's office will get a copy of that letter as well if the beneficiary decides to appeal.
Thank you, Amy. Next question here is, for high-cost medications, example, those over $9,999, if a claim is reversed, will prior approval still be required upon resubmission, or does the reversal eliminate that requirement? Kelly, this is back at you. Can you help us with this question?
Sure. An override is required for initial claims over the $9,999 threshold. However, Prime's call center team authorizes and enters these overrides for 1 full year, so repeat authorizations will not be required for the same claim. So we hope that will be a positive change.
Thank you, Kelly. All right, our next question here. Will our NCID login give us access to the Prime Therapeutics portal after May 2nd? Kelly, please.
Sure. So yes, the NCID credentials will provide access to the Prime Therapeutics Pharmacy Provider Portal via the MES landing page. So a couple of potential things to do. Providers do not need to register separately for the Prime Therapeutics Pharmacy Provider Portal, and access will be managed through Prime's portal login and user account setup.
Thank you very much. All right, next question. Will NC-TRACS still be able to look at eligibility? Kim Phelps, can you help us with this question?
Certainly. Yes, NC-TRACS will still be available for eligibility verification, in addition to the Prime portal, which was demoed earlier. That will also be available to check eligibility for those secured users. Eligibility is available through the Prime PBA Pharmacy portal, and providers can continue using NC-TRACS to check member eligibility.
Thank you so much, Kim. Next question here. How will NC Medicaid Direct ensure providers receive timely support and avoid escalation for pharmacy-related issues? All right, Kelly, you're on a roll. Can you help us with this, please?
Sure. So NC Medicaid Direct will provide a centralized support model to ensure timely, consistent resolution of pharmacy-related issues. So what you can expect: 24/7, 365 pharmacy provider support through the dedicated Prime Pharmacy Provider Call Center. We will have enhanced provider training and resources both before and after go live. Standardized processes should reduce the need for escalations, and then we also plan to have clear routing to the appropriate support teams for faster issue resolution.
Thank you, Kelly. Okay, next question here. How are EPSDT requirements incorporated into Prime Therapeutics clinical and prior authorization processes? And Amy, can you help us with this one?
I can help with that. Just so everyone is aware, EPSDT, what that stands for is Early and Periodic Screening, Diagnostic and Treatment. And it's a program, a mandatory program for children that are under 21, so that if something may not necessarily be covered in general, that the review for coverage, if a provider thinks it's medically necessary for that particular child, that there can be a review for that to see if something might be covered. So the EPSDT requirements, they are incorporated into the clinical review and PA process. All prior authorizations for beneficiaries under the age of 21 are reviewed for EPSDT criteria if they do not meet the regular or the state criteria. So what does this mean? For patients that are under 21, they are evaluated in accordance with the EPSDT requirements. Coverage decisions consider medical necessity and EPSDT policy, even when the services may not be covered for adults. And Prime Therapeutics has been trained, and processes are designed to ensure consistent application of EPSDT guidelines. EPSDT is a program that is not only for North Carolina, but it's a program that are in all 50 states. So Prime also does other states, so they are very familiar with EPSDT and how those reviews should be handled.
Thank you so much, Amy. This now concludes the set of questions that we received from the first webinar. I'll go ahead and turn it back over to John for some closing remarks here.
Thank you, Coffee. All right. Well, thank you everyone for attending tonight. We appreciate everyone attending and taking the time to learn more about the new Prime PBA system and seeing some of the demos for Medicaid Direct. The team will now attach the survey link for the webinar, so please feel free to complete that link. Let us know how we did, and I'll hand it back over to Penny now to close us out. Thank you.
Yes, a lot of information. Thank you to both North Carolina's Medicaid team, as well as Prime Therapeutics team. Really appreciate all the time and effort. This group has been working overtime, quite frankly, pulling together all the information for this evening. I want to thank the audience for turning out to learn as much as possible about this transition. We will be, this evening has been recorded. We will be putting that information up on our website, and we'll be sharing that link with North Carolina Medicaid so that they can also put it out in their news for future access. So without really anything further, I think all the questions that were in chat look like they were covered, as were all of the detailed information that came in from the last webinar's questions were covered in that FAQ. So thank you everyone for a great evening. Really appreciate the turnout, and we look